Okay, so this is my student ID. Just taking some time to autofocus. All right. Knock knock. Hi, I'm Hong Do. I'm going to be your family nurse practitioner for today, student from UTA. We'll be doing a head-to-toe assessment. Do you have any questions for me?
No.
All right, so I'm going to go ahead and wash my hands. All right, so I'm just going to ask you a couple questions before we get started. Can you go ahead and tell me your name?
Tone Win,
Okay, and how old are you, Mr. Wynn?
18.
Okay, and can you tell me where you're at today?
Family clinic.
Okay, and what are you here to do?
Get a head-to-toe checkup.
Okay, and can you tell me what date today is?
August 2nd, 2016.
Okay, and can you tell me the mood that you're in today?
I feel alright.
Okay, patient is alert and oriented to place, person, time, and patient, it states that patient is in a good mood, which is congruent with patient's affect. Patient is currently dressed appropriately for the setting with good communication. So Tone, I'm going to just start off by assessing your hair. Okay. Patient's hair is coarse and black without infestations. I'm going to go ahead and check your scalp. Okay. Patient's scalp is free of lesions, erythema, no rashes. Go ahead and palpate. Okay. Patient's head is free of masses and nodules. Did you feel any sensitivity, tenderness?
No.
No. Okay. Patient denies any tenderness. Next, I'm going to just take a look and do an inspection of the head. Patient has no. Patient's head is symmetrical, round, and normal cephalic. There's no twitching to the face or the head. Patient's posture is erect and appropriate. Patient's eyebrows is symmetrical bilaterally with hairs evenly distributed with no infestations. Patient's eyelids are also bilaterally symmetrical. Patient's eyelashes are also hairs evenly distributed symmetrically. Patient's sclera is clear. Patient's eyes, conjunctiva is clear. Sclera is white. Pupils is brown. I'm sorry. Patient's iris is brown. Pupils are equal and round. Patient's, okay, no drainage. Oh, I'm so sorry. I'm gonna have you close your eyes. I just put my hands on your eyes, but I didn't tell you. Let me go ahead and have you close your eyes. I'm just gonna palpate your eyes. Okay. Did you feel any pain?
No.
Okay. Patient is free of masses and pain. Eyes sockets are intact. No lacrimal apparatus present. No exudate and no drainage. Okay. So the next thing I'm going to do is we're going to just take a look at your pupils. Okay, I'll go ahead and have you look at my nose. Okay, bilateral eyes are reactive to light. Next, I'm going to have you take a look at this pen, and it's going to go directly into, and just follow it. Okay, and that's accommodation. Bilateral eyes accommodate to the movement of the light and constrict, the movement of the pen and constrict. Next, I'm going to have you, I'm going to check your EOM. Basically what I'm going to do is have you follow my pen light. You're going to follow with your eyes and not your head, okay? I'm sorry. So let me start this over again. Ready? Okay, patient's 6 cardinal fields are intact. The next thing that I'm going to do is we're going to check congruency. Basically, I'm just going to have you look at that corner right there. Okay. So I'd like to report that the right eye is congruent with the left eye, does constrict with light. Okay, and again, the left eye is congruent with the right eye. When light is shined upon it, it does constrict as well. Okay, so Mr. Nguyen, usually there's 2 different types of vision tests. There is the Snell vision test that is tested for distant central vision acuity. Basically what happens is a patient stands 20 feet away, covers each one of their eyes, and tries to read the smallest line that they can see. And then what they do is then open up both eyes and try to see what's the smallest line that they can see. If they wear glasses, then we will have them take off their glasses and then perform the test there to see what their vision acuity is. Here we do the Rosenberg vision test, which is a near central vision acuity test. Basically what I'll do is I'll be holding this about 14 inches away from your eyes, and then I'm going to have you cover one of your eyes, and I'm going to have you read the lowest line, smallest line that you can see.
9, 3, 7, 8, 2, 6.
Okay, and I'll have you close the next eye. Go ahead and tell me the smallest line that you can see.
2, 7. Oh wait. 3, 7, 4, 2, 5, 8.
Okay, please note that the patient's left eye is 20/30 and the patient's right eye is 20/25. Patient will probably need a follow-up to the optometrist's office for a possible rescreening of the eyes for possible glasses. Okay, so the next thing that I'm going to do is we're going to take a look at your ears. First thing I'm going to do is just inspect it. Patient's pinnacle is, patient's ears are symmetrical. The pinnacles are midline to the eye canalis. Go ahead and palpate. Okay, any tenderness felt? Okay, patient denies tenderness. There are no nodules or masses felt, and no abrasions or drainage coming out of the ears. So the next thing that we're going to do is, I'm first going to check inside your eyes first. Okay, and we're going to check your cornea reflexes, okay? Okay, so I'm going to have you just sit still, and then I'm going to come in towards you. Okay, red reflex present. Optical disc is clear and round with no hemorrhages present. Alright? Okay, red reflex is present. Optical disc is clear and round with no hemorrhages present. Okay, and then now I'm just going to listen to the ears. I'm going to look at your ears inside it. Okay, we'll start with the right side, and I'm going to go ahead and have you tilt your ear a little bit for me to the side. Okay, tympanic membrane is pearly gray. Bony landmarks are present and intact. No ruptures or membranes. Cone of light is at 5 o'clock. Right. Okay, we're looking at the left ear. Same thing. Go ahead and tilt your head a little bit for me. Okay. All right. Tympanic membrane is pearly gray. Bony landmarks are present, no rupture of membranes, no abscess. Cone of light is at 7 o'clock. Okay. So the next thing I'm going to do is it's called the whisper test. I'm going to have you cover one of your ears. I'm going to whisper a word and I'm going to have you say it back to me. Can you scoot forward just a little bit for me, please? All right?
Apple pie.
Okay. Go ahead and cover the other ear.
Soda.
Okay, so patient passed the whisper test. So the next test that I'm going to perform on you, Tone, is called the Webster test. Basically, I'm going to be placing this tuning fork on top of your head. I'm going to have you tell me where you can hear the sounds from, either from both ears or from which of the ears that you can hear it from, okay?
From both.
All right. Patient passes the Webster test. Patient can hear from both ears. The next thing that I'm going to do is called the Rhine test, and the Rhine test basically will, I'll be placing one end of the tuning fork to one side. You're going to tell me when you can stop hearing it, then I'll place it to another side of the ear, then you're going to tell me when you can stop hearing it, okay?
Stop. Stop.
Okay.
Stop. Stop.
Okay, patient's Rhine test is 2 to 1. Patient was able to listen bilaterally 20 to 10 on both ears. Okay, so the next thing that I'm going to do is I am going to palpate the sinuses, the frontal sinuses, and the maxillary sinuses. Any sensitivity? Any
No.
tenderness? Okay. No nodules or masses palpated. Patient denies any tenderness to the sinuses. Okay, the next thing I'm going to do is take a look at your nose. Nose is symmetrical. And now nares are bilateral, intact. So Tone, I'm going to have you go ahead and cover one of your nostrils and breathe out of it. Okay, and then go ahead and do to the other. Okay, both nostrils are patent and intact. Next thing I'm going to do is I'm going to look inside your nose. The new spectrum. Okay, go ahead and tilt your head back for me slightly. Okay, bilateral nasal captivity is pink and moist, no polyps present, septum is intact. Okay. Okay, I'm just going to transilluminate your maxillary. Go ahead and open for me. Open big. Okay, go ahead and open for me. And open big. Okay. Patient's maxillary sinuses are intact. Okay. The next thing that we're going to do is look at the lips. Patient's lips are pink and dry. Go ahead and open your mouth for me. Okay, go ahead and stick out your tongue for me. Patient's tongue is pink and moist and symmetrical. Go ahead and lift your tongue up. Patient's frenulum is intact. Go ahead and stick your tongue out for me and say ah. Okay, patient's uvula is midline and moves symmetrical when patient says ah. Patient's pharynx is pink. Patient's tonsils are removed. No exudates from the oral cavity. Go ahead and open for me. Patient's teeth are white. Let's go ahead and count the teeth. Patient has 28 teeth. No wisdom teeth are present. Okay, so now I'm going to palpate your lymph nodes. We have the occipital lymph nodes, the preauricular lymph nodes, the postauricular lymph nodes, the tonsilicular lymph nodes, submandibular lymph nodes, segmental lymph nodes. Okay, posterior cervical chain, anterior cervical chains. Okay, go ahead and scrunch your shoulders a little bit for me. Relax a little bit. Subclavicular lymph nodes. Lift your armpits up a little bit. Axillary lymph nodes. Okay. Apollinear lymph nodes. Okay. Did you feel any tenderness?
No.
Okay. No palpable lymph nodes detected. Patient denies any tenderness. The next thing I'm going to do is just palpate your, take a look at your neck. Neck is symmetrical, no mass is noted, no enlargement of the neck observed. Trachea is midline. Go ahead and palpate arteries, carotid arteries. Okay, carotid arteries are 2+ out of 4+. I'm going to go ahead and listen for a bruit with my bell. Okay, no breweries present at this time. Okay, I'm just going to take a look at your fingernails and your hands. Patient's skin is again tan without lesions. Patient's cuticles are intact. Nail beds are also intact. Okay, patient's toenails are also intact. No edema to the hands or to the legs. Cap refills are less than 3 seconds for the fingers and the toes. So Tone, I'm going to have you put your fingernails together, each one of them. Okay, patient's fingernails angles is 160, which is appropriate and within normal range. The next thing that I'm going to do is palpate the rest of the other arteries as well too. So this is the temporal. Okay, the brachial. Okay. Radial. Posterior tibialis. Dorsal pedialis. Okay. Patient's pulses bilaterally are 2+. So Tone, now what I'm going to have you do is go ahead and take off your shirt. And we're going to do some assessment there. Awesome, thank you so much. So basically we're just going to do an observation of the skin. Again, patient's skin is clean, nice, dry, moist, clean, tan, intact, no hair observed, no tattoos observed, no piercings observed at this time, no abrasions, slight eczema to the elbows, Patient's AP ratio is 2 to 1. What I'm gonna do now is I'm gonna listen to breath sounds. Okay, I'm gonna be listening to the brachial, tracheal region. Okay, brachiovesicular region. And then this is a brachial region. Okay, the posterior brachial region. Okay, and listen to the back. Okay, patient's breath sounds are clear throughout with no amphitatious sounds. I'm just gonna count your respirations. Okay, so we have 22 as the respirations. The next thing we're going to do is the fermentus tactalis. Basically what I'm going to do is I'm going to have you say 99.
99, 99, 99, 99.
Okay. Okay, go ahead.
99, 99, 99, 99, 99.
Okay, no resistance, no hyperresistance heard throughout. So tone, the next thing I'm gonna do is I'm gonna observe your cardiac system, your heart. So no heaves or lifts observed. Just gonna palpate the PMI. Okay, no thrills palpated. The next thing I'm gonna do is listen to the heart with my diaphragm. Okay, this is the second intercostal space, right sternal border, aortic. Okay, S2 is greater than S1. Second intercostal space, left sternal border, pulmonic. Okay, S2 is greater than S1. Third intercostal space, Erb's point, left sternal border. S2 and S1 are equal. Fourth intercostal space, left sternal border, tricuspid valve. S1 is greater than S2. Fifth intercostal space, midclavicular line, mitral valve. Okay, S1 is heard louder than S2. I'm going to go ahead and listen for a heartbeat, your heart rate. Okay, patient's heart rate is 76 beats per minute. The next thing I'm going to do is listen with the bell. Second intercostal space, right sternal border aortic. Okay. Second intercostal space, left sternal border pulmonic. Third intercostal space, left sternal border Erb's point. Fourth intercostal space, left sternal border tricuspid. Okay. Fifth intercostal space, midclavicular line, mitral. Okay. No gallops, no murmurs, no splitting heard. Okay, so tone. What I'm gonna have you do now is lay down, and we're gonna listen and look at your stomach. Okay. Patient's abdomen is flat, and there is no pulsations, no visible venous arteries present. Go ahead and listen. Okay, bowel sounds are heard in all four quadrants and also in the epigastric region. So the next thing we're going to do is we're going to percuss. Okay. Timpani is heard in all five regions, all four quadrants of the abdomen, and also in the epigastric region. Next, we're going to do measurements for the liver span. Okay, we're going to start at the umbilicus. Gonna measure that. Okay, it shows about 6 centimeters liver span, which is within normal range. Normal ranges is from 6 to 12 centimeters. The next thing we're gonna do is a liver percussion for the liver span. The liver span is within range, is from the 6th intercostal space to the 10th intercostal space. Next thing I'm gonna do is I'm gonna do a light palpation. Go ahead and relax. Okay, did you feel any tenderness?
No.
Okay, next thing I'm gonna do is deep palpations. Okay, any tenderness?
No.
Okay. Patient denies any tenderness at this time. I'm just gonna do the Murray's test. Okay, no liver palpable, any pain.
No.
Okay, and no gallstones detected as well, so we have a negative Murray's test. All right, so before you get up, I'm gonna go ahead and have you stretch one leg out and bend one knee. Basically, it's gonna be at about 80 to 90-degree angle on your knees. Go ahead and relax. Okay. Okay, ready? Okay. Okay, and this is an negative anterior jaw test. Patient's tibial lateralis is less than 5 degrees. I'm going to go ahead and have you do the next thing to the next knee as well. Go ahead and relax. Okay, our left knee is also, leg is also negative for an anterior draw test. Less than 5-degree angle on the tibial lateralis as well. Okay, so Tone, I'll go ahead and have you stand up. Okay, I'm going to have you get up, and then I'm going to have you walk from this end to this end. Patient's posture again is erect. Patient's gait is within defined limits. Patient's hands sway side to side symmetrically. Okay, I'm going to have you turn to the side, and Tone, go ahead and bend down and touch your knees. I'm sorry, touch your toes. Okay, patient's scapula is nothing is risen. Patient's spine looks intact, and I'll have you go ahead and stand up slowly. Okay, shoulders are symmetrical, and so are the hips. We have a negative scoliosis test at this time. Right, go ahead and put back on your shirt. Okay, and then after you put it back on your shirt, I'm going to have you just stand back up for me for one more second. We're going to do the, it's called the Romberg test.